What are some new therapies that are still in clinical trials to consider for relapsed myeloma?
We have numerous clinical trials that we prefer patients consider to look for antibody-drug conjugates or chimeric antigen receptor T cells to treat patients with uncontrolled myeloma.
What are some of the latest treatment options for relapsed and refractory myeloma?
A lot of these are still in very, very early testing. I look at it more as new classes of drugs. So there are bispecific T-cell engager drugs, which we're very excited about. They have different targets on the myeloma cell, and there are multiple ones, some targeting BCMA, some targeting GPRC5. Then there are also antibody drug conjugates, so basically antibodies linked to a warhead chemotherapy drug. The one that's furthest along is belantamab, so against BCMA. And then obviously CAR T cells, we still remain extremely excited about many different CAR T constructs and how to do better with CAR Ts.
So at our center, our preferred second-line therapy for relapsed myeloma is Darzalex, Pomalyst, and dexamethasone. And that's assuming somebody has had 3 or 4 drug initial therapy, transplant, been on maintenance, and then they relapse. They'll often get moved to Darzalex, Pom, and Dex. Our preferred third-line regimen is not well known. We don't know what to do. Many times patients are getting Kyprolis, Pomalyst, and dexamethasone, but then we go completely off the ranch, and there's no clear evidence to say that any one cocktail works at third line, fourth line, fifth line. Options are many. You can use re-expose patients or infuse patients with alkylators for the first time if they've never had an autologous transplant. You can use some of the newer drugs like selinexor in combination with Pomalyst or Kyprolis for patients who have relapsed disease. Certainly they could combine selinexor with Darzalex if they've never been exposed to a CD38 antibody.
Choosing a treatment for relapsed refractory myeloma is very personal, and various factors need to be considered. Dr. Hoffmeister offered suggestions from his center, which is the Winship Cancer Institute in Atlanta, Georgia. The Mayo Clinic also has guidelines known as MSMART, which are seen here. As you can see, there is no one right choice. HealthTree also can be used to identify treatment options based on your individualized profile. These choices have been vetted by myeloma specialists and are reviewed every 6 months or as new drugs are approved. It's important to discuss all the treatment options with your myeloma specialist to find the therapy that is just right for you. HealthTree lets you see personalized, relevant treatment options for you to consider at every stage of your disease treatment. Find your treatment options by clicking on the Treatment Options tile on the HealthTree homepage. There, you can see different categories of treatments you can consider, how individuals' therapies are rated by myeloma specialists for someone in your situation, and information about each treatment so you can take these treatment options to your doctor and consider them together.